Subscribe to my channel to learn about health-related knowledge. What I will talk about today is, what are the symptoms of uterine fibroids? Middle-aged women often suffer from uterine fibroids. Most of the fibroids are small and asymptomatic. They are usually found during physical examination. But with the growth of uterine fibroids, related clinical symptoms will appear. The symptoms of fibroids are mainly affected by the size of the fibroids and where they grow. Under normal circumstances, the common symptoms of uterine fibroids are 1. Uterine bleeding. More than half of symptomatic patients will appear, of which periodic bleeding is the main cause, accompanied by increased menstrual flow, prolonged or shortened menstrual cycles. 2. Menstrual disorders. Irregular menstruation appeared, and menstruation reappeared after a few days. 3. Increased vaginal discharge. As the uterine cavity enlarges, the endometrial glands increase, coupled with the pelvic cavity filling. A series of changes can increase vaginal secretions. 4. Secondary anemia. Long-term menorrhagia or irregular vaginal bleeding can lead to anemia, which manifests as general weakness, paleness, shortness of breath, palpitation, and other symptoms. 5. Pain. Under normal circumstances, there will be no pain symptoms, but fibroids grow too large and compress nerves, resulting in the lower abdominal bulge and low back pain. 6. Abdominal lumps. After uterine fibroids grow to a certain extent, it is easy to find abdominal masses during physical examination. Generally, they can be touched when the uterus is enlarged for more than 3 months of normal pregnancy. 7. The uterus is enlarged. When the fibroids increase to a certain extent, it indirectly causes an increase in the size of the uterus. 8. Compression symptoms. Due to the special physiological position of the uterus, when the uterus enlarges due to fibroids, it is easy to compress the bladder, urethra or rectum, causing frequent urination, dysuria, urinary retention or constipation. When it compresses the ureter, it can cause ureter or renal pelvis. It compresses the pelvic blood vessels and lymphatic vessels, which can cause edema of the lower extremities. 9. Infertility and miscarriage. Uterine fibroids can cause deformation of the uterus, which is not conducive to the implantation of fertilized eggs. At the same time, it affects endometrial function and is not conducive to embryo growth after implantation. Many factors lead to infertility in patients. Some patients will experience recurrent miscarriage. Tip: generally, patients with uterine fibroids should be treated when they have corresponding clinical symptoms to avoid further development of the disease and affect the quality of life.